Out of that promising news in the race for a vaccine here in the U.S., news on the first stage vaccine trial, Moderna, reporting so far that their vaccine is safe and that it produced antibodies at about the same levels as patients who have now recovered from the infection. And so ABC's Steve Osunsami tonight on what comes next and the timeline now.
It's the break the whole world has been hoping for. An American company working on a vaccine for the coronavirus says that all 45 of their test patients tonight are producing antibodies that fight the disease.
It's been like almost nothing. It's literally, it's been like getting a flu shot.
Norman Hume of Atlanta feels great this evening, and that matters to everyone because today he received his second dose of a vaccine being produced by Moderna Labs. His first was a month ago.
The ability to have one small role in just getting beyond this pandemic is an amazing opportunity.
In these early results, those 45 patients developed the same level of antibodies as someone who has recovered from COVID-19. The company then tested the blood of 8 of those patients against the actual coronavirus, and in all 8 cases, the virus was killed.
But are those antibodies likely to be protective? Are they neutralizing the virus? And actually, we saw, in fact, in all cases they were, which was really encouraging.
Any day now, they plan to move on to phase 2 testing, where about 600 patients will get the 2 shots, and scientists will watch for any surprises. By July, they expect to move to the next level, between 1,000 and 10,000 patients testing the vaccine. And if all goes well, they hope the drug can be ready by the end of the year. The president has the same goal, calling it Operation Warp Speed.
Its objective is to finish developing and then to manufacture and distribute a proven coronavirus vaccine as fast as possible.
But just making the drug in millions of doses and getting it to Americans is complicated. And scientists say it's still not clear if this vaccine will truly be effective in real use.
The fact that the Moderna vaccine has been shown to be safe and generate a robust immune response in small numbers of patients is very promising. But now it has to be proven in larger numbers.
Steve Osunsami with us live from the CDC. And Steve, in terms of manufacturing, Dr. Anthony Fauci has said best case scenario could take 6 to 9 months to ramp up from when there's a test, and that's if everything goes smoothly.
Yes, David, even if this vaccine were ready to go today, you still have to put it into something that can be shipped across the country, potentially across the world. These vaccines are also temperature sensitive, so this will require a bit of time and collaboration. David.
There is still so much hope surrounding these vaccines.
This is the Wuhan of Europe, where it started and where it was worst. Hospitals totally overwhelmed back in March. And like us in the UK, they didn't have enough testing. So they don't really know how many people died. But they've measured excess death. How many people died this time last year compared to this time this year. Now, in England and Wales, the increase is 113%. In Bergamo province, 568%. And in the village of Nembro, where I went today, 1,000%. So now lockdown is beginning to ease. No wonder what we found was a mixture of relief and fear and shock. It's a village of churches. But when the epidemic was at its height, they stopped tolling the bell for the dead in Nembro because there were just too many. Now restrictions have been lifted, you can visit the cemetery. So the Giovanni Morotti. Delia Morotti has come to see the temporary memorial to her parents, both in their 80s, married for 59 years. She was barred from seeing her father in hospital for fear of spreading the infection further, so she called him instead.
Capiva che stava morendo e mi diceva: io ho dolori dappertutto, non riesco a respirare. Quando vieni? Continuava a chiedermi: non posso papà, ancora qualche giorno. E le ultime parole sono state: va bene, io sto morendo. Mi raccomando, la mamma. Sono state le sue ultime parole. Basta.
But like others tending newly dug graves, she couldn't save her mother. In Nembro, 12 people died last year in the month of March. This March, 151 died. Delia was allowed into the hospital morgue to see her mother's body.
E vi dico che era piena di cadaveri, un sacco di persone, chi in terra coperti, chi nei lettini, chi sui tavoli, pieno di morti.
I'm so sorry.
Mi mancano tanti.
The shadow of death seems far from this valley. In Nembro and neighbouring villages, people live long and healthy lives. After generations of peace and prosperity, no one was prepared. Not the hospitals, not the local government, not the people. We've had a very rough time, she tells me. Very, very rough. Nembro's coming back to life, but everyone I've met here has lost someone to COVID-19. In 1630, 3/4 of the population of Nembro was wiped out by the plague. History doesn't repeat itself, but there is a sense of shock here. Such a relief to sit in the piazza like they used to do. But there are questions. Why did it take 2 weeks to lock down after the first death? Why was the local hospital at Alzano overwhelmed? Did the local government make mistakes?
Errori tantissimi. Solo la chiusura di non aver chiuso Nembro e Alzano è stato un grande errore. Partendo dall'ospedale di Alzano, che è stato un disastro, qua probabilmente ci sono tante aziende che hanno voluto aspettare la chiusura per le aziende. Dicono però.
And what if there's a second wave?
Se dovrebbe succedere un altro caso, in Italia siamo tutti fritti. Tutti morti.
Only the young seem optimistic.
But now it seems normally. Yes, it was difficult, but the worst seems past.
As they mourn, people think back to January and February, when their relatives started to fall ill and no one understood why.
C'era già qualcosa nell'aria, c'era qualcosa di strano. Poi non lo so se è stato uno tsunami, qui nella nostra valle sono morti tutti queste persone anziane.
The time for denial is long gone, and anger is coming to a village engulfed by sorrow.